And just one more question. Let's talk briefly about cerebral palsy, that I believe it's the most common condition that you see. So what approach do you usually use? That is something specific on the treatment in particular that you want to talk about or mention?
Mm-hmm. So cerebral palsy is a brain injury, but it's a brain injury that's acquired close to birth. So either intrauterine or perinatal or within the first 2 years of life. And the reason we don't name it brain injury is because the presentation is different for the reasons that I mentioned earlier when I spoke about how children are different from adults. But it is a neurological condition. It's a non-progressive lesion in the brain, just like a stroke is a non-progressive lesion in the brain. There's a bleed or an anoxic episode that causes damage to the brain itself. The lesion doesn't change in the brain, but the effects of it can be progressive. And in cerebral palsy, it is primarily a disorder of movement and postural control. So just like in a stroke, strokes are usually in one hemisphere, and that side of the body, the opposite side of the body from the lesion is impaired. In cerebral palsy, the lesion can be unilateral or bilateral, but the presentations are to some extent predictable, just like in stroke. Every stroke is different, but there are commonalities between them. And the same is true in cerebral palsy. So we tend to see things like spasticity and poor motor control and poor postural alignment. And that's where I tend to use the light gate even more so than I would in adult populations, because the light gate as a body weight support system is designed to correct the person's posture while they're in the device. So not only does it create a false-free environment so that your hands are free as the clinician to provide whatever assistance and cues you want to provide. So it's really designed to as a treatment environment. In aquatic therapy, you can't help the person down at their feet because that's underwater. And without a scuba tank, I couldn't do that. But what body weight support devices do is they sort of create that buoyant, false-free environment on land. And the light gate gives you access to the person's body to provide whatever cues you need to. But more than any other body weight support system, the light gate corrects the person's posture. And so, for example, in spastic diplegic cerebral palsy, which is a very common distribution of cerebral palsy, the legs are more impaired than the arms. So lower body is more impaired than upper body. And as a result, what we tend to see is a postural alignment where the shoulders are very far forward relative to the pelvis. So they have a hard time maintaining that postural alignment of shoulders over hips. Well, if your trunk is forward inclined, which we see in adult populations as well, everybody in Parkinson's disease has a stooped posture or forward lean in their posture. That's a hallmark of Parkinson's disease, and forward head and shoulders is a hallmark of spastic diplegic cerebral palsy. What happens is now the center of mass is very far forward. And if the center of mass is far forward, the biomechanics are going to be different. So in order to stay upright, if your center of mass is very far forward, you need to fire your extensors more to not fall over. And it's more likely that your center of mass is going to fall outside of your base of support because your base of support ends at your toes. So if your center of mass is forward, you can kind of spend your life trying to catch up and reestablish a new base of support, but you're fighting this losing battle. And the final impact of that center of mass being too far forward is that your line of gravity is not going to fall relative to your lower extremity joints in a way that creates the normal flexion and extension moments that are part of normal gait. So your gait is going to be affected. And so if I can take the biomechanics and help to normalize them by creating a postural alignment that's upright, I can elicit a more normal, fluid, energy efficient gait or motor pattern than I could if that postural alignment is the typical alignment of somebody with cerebral palsy. So by creating a treatment environment with good postural alignment, now I can provide the stimulus that I need to, whether it's a moving treadmill surface or a visual or a verbal cue or a tactile cue, to get that movement to take place where they're not fighting this sort of losing battle. So if you think about like in horse racing, the handicap of the horse or how much weight you put on that horse depends on how good the horse is. Well, children with cerebral palsy, as I said, they're starting from a lower motor performance status. And it's like we've weighed them down by adding more weight. That's not what we do in horse racing. The good horses get more weight and the slower horses carry less weight. But because of the postural alignment, they're fighting that battle with that added weight. And that's really not setting them up for success. So if I can take that weight off and make it more similar to what we do in horse racing, where the person, the competitor who's maybe not as developed or not as good of a racer carries less weight, that would be a good thing. And correcting the person's posture so that the line of gravity falls relative to the joint axis where it should at the right moment in the gait cycle sets them up for more success. It makes the task easier, and they can learn that less effort can accomplish the same task. What we see in children with cerebral palsy is that everything we're asking them to do is a maximum voluntary effort, and that's not sustainable. If you think about your participation in sports, right? If you're doing a sprint and you're running as fast as you possibly can, what's your distance for your dash? 100 meters, 200 meters, right? That's as long as you can keep going at your maximum voluntary effort. As a matter of fact, sprinters, their effort is so high when they're running. During short distances, they don't even take a breath in their sprint, because that would detract from their performance. How sustainable is that? 20 seconds, maybe. Now imagine everything that you're doing all day, just staying up against gravity is a maximum voluntary effort. And now I'm supposed to have leftover reserves in my brain to do something else, to look where I'm going, to pay attention in my school classes. It's too much to ask of someone. So what we need to do is we need to set them up for success so that everything they do is not a maximum voluntary effort, because maximum effort is not sustainable. So we need to teach them more fluid, efficient ways to perform the task. Not only to make it sustainable, but to free up their cognitive capacity to be doing something else at the same time. You and I don't think about walking when we walk. Right? We're talking on the phone and texting and drinking our coffee and window shopping, and our feet just keep going. It becomes so automatic, it's reflexive. I want that same level of performance for a child with a motor impairment like cerebral palsy, so that their legs can keep going without them looking at their feet, without them thinking about their feet. But we need to give them the practice that allows them to learn that. And that means setting them up for success by correcting their postural alignment and putting them in a safe environment so that they can practice a lot. When typically developing children are learning how to walk, they cover 2,900 meters a day. They walk half the time that they're awake, and they literally never stop. They take 9,000 steps a day. But children with cerebral palsy don't have the same opportunity for practice because they can't do it without help. So anything that gives them more practice is a good thing. And so that's where I love that environment of the light gate and the treadmill, because it affords more practice. If you think about a typical physical therapy session in an adult who's had a stroke, how many steps do they really take in a session? 100? But they've already walked at some point in their life, right? So if you're getting 100 steps in a 30-minute physical therapy session, or if you're walking for 8 minutes out of that 30-minute session, the number of steps that you take in those 8 minutes is actually really important. And that environment of the light gate on the treadmill affords you more steps. You never need to stop and turn around because you're running out of space. You can find that rhythm that is hard to get over ground. You can offload the upper body and make that lower body that's impaired do more of the work. And so by setting them up to get more practice, by making it more energy efficient, you may not get those 9,000 steps a day, but you're going to get more than the 100 steps that they would be able to receive if they're relying on physical support from another person. Typically, developing children learn how to walk when their parents turn their backs. Children with cerebral palsy don't, because they don't have enough baseline skill to do that. So we need to put things in place that make them able to practice more.